Hi, in this vlog I will ask two athletes to perform two movements and assess whether they have a skills or capacity issue. My first athlete is a 30-year-old soccer and Gaelic football player performing a back squat. As you can see from the video, the athlete has the inability to perform the back squats successfully due to a limited range of motion in the ankle, hips, and lack of core stabilization. From the front and rear view, the movement is initiated with a bend in the knees and a descent to the bottom of the position. From the front view, during the descent, the right foot moves outside the prescribed 5-to-1 stance, which indicates an issue with ankle mobility. The knee deviates laterally, which may indicate a weakness in adductor activation. It also appears the weight is supported on the left leg, which highlights a lateral shift of the hip. When this happens, the side to which it shifts exhibits less hip adduction, poor ankle mobility, and internal rotation. There is also a dip in the right shoulder as the bottom position approaches, which may indicate a lack of barbell control due to incorrect posture. From the side view, it is evident as the athlete descends from the starting position to the bottom position that the weight is on his toes with a slight lift of the heels in the bottom position. The bar shifts off the midline, causing the head to move over the knee, and an imbalanced descent occurs, indicating a lack of core stability in addition to stiff hip flexors. The full bottom squat position is not achieved as the hip does not reach the required depth. The focus before attempting any more weighted squats was to increase range of motion in the lower body with emphasis on the joints pertaining to the squats. To address the deficiencies observed in the movement, a few assessments were used to gain a better understanding of each joint. For the ankles, we did a weight-bearing lunge test, and as you can see, the athlete fails to reach the wall on both sides with a more profound lift in the left foot. To improve the ankle mobility, we did an elevated lunge with a forward lean, therefore passively increasing the joint through static stretching. The athlete responded to the exercise and reported a release of tension from the back of the heel to the glutes. For the hip, we assessed a modified Thomas test to see the range of movement in the hip and if there are other restrictions leading to limitations. What we observed was upon pulling the right knee to the chest, the left leg lifted slightly, indicating a stiffness in the quads and hips. The same was observed for the left leg. To alleviate some of the stiffness, I asked the athlete to perform a couch stretch and hold the stretch for 30 seconds. To address the varus movement of the knee, we needed to strengthen the adductor muscles, and to do this, I asked Fitz to perform an adductor ball squeeze for 3 sets of 12 reps. This will ensure adequate recruitment and force generation in the area and the necessary activation needed for the squat. In addition, banded walks were performed to activate the glutes to address the lack of hip abduction. To progress back to performing the back squat adequately, further strength training such as wall sit was suggested for increased strength of the lower limbs and balance. Furthermore, alternative squats were used to improve the movement capacity, such as chair taps. This keeps your weight centered and balanced, and it allows Fitz to focus on the hip hinge movement. It also builds your glutes. Pole-assisted squats allowed him to achieve the correct depth and be comfortable enough to hold it for 30 seconds or more. Raised heel squats achieved the same outcome. For the retest, it shows that there was an overall improvement in the movement capacity in the areas of concern. For the second movement, we made use of the overhead press. As you can see from the front view, Fitz has his hands in the incorrect position, as a result flares his elbows. From the side view, it is evident that the bar is following a curved path. This is due to a lack of core control, which results in his rib cage flaring and putting stress on the lower back. This can be seen by the excessive arching of the back when attempting to press the bar over the head. This is due to a lack of mobility in the spine and shoulder region of the back. To address the thoracic extension and upward shoulder rotation, we did a shoulder flexion test to evaluate the flexibility and mobility of the shoulder joint. The test results showed that there is a restriction in the latissimus dorsi region of the back, which prevents the shoulders from extending the arm up and behind the back. To fix this, we performed a myofascial release by foam rolling the lats for 30 seconds on each side. After which, I asked Fitz to complete the bench T-spine extension mobilization with lat stretch for 30 seconds. This will release tension in the upper body and improve posture. Other movements not recorded but equally as important to the mobilization of the spine are side-lying book openers and quadruple thoracic rotations. To further improve the movement, it is important to stabilize the core below the bar. To do so, the core needs to be activated and strengthened. Hollow rocks can be done to increase midline stability and control. By increasing midline stability, we can help resist forces on the spine and also learn to generate core tension and create greater stability during loaded movements. In addition, the glute bridge is an effective exercise to work your core, strengthen your back, and stretch your chest and shoulders. The muscle it works is glutes, quads, hamstrings, calves, and core. The hip and the lower back muscles and the stabilization of the spinal cord is imperative in the overhead press. Additional strength exercises such as the seated dumbbell press and half kneeling press can be used as progression to build the necessary strength needed to perform the overhead press successfully. For the retest, we used a dowel stick so that the emphasis was on contracting the quads and the glutes and creating tension in the core. This drastically improved the movement pattern. Our next athlete is Brett, a 50-year-old triathlete. During the performance of the squat from the front, you will see that there is a slight outward movement of the right foot, but the knees, hips, and trunk are relatively stable in the descent and ascent phases of the movement. The same is observed from the back. From the side view, Brett shows good control in the torso, with flexion in the hips and knees during the descent. The bar follows a relatively stable path with moments of deviation from the base of support, which suggests a loss of core stability and some hip and ankle restriction. As a result, doesn't allow him to keep the weight on his heels. While performing the squat, Brett reported a stiffness in the back of the heels, indicating the need for mobility intervention. We made use of the goblet stretch, where the athlete uses the kettlebell to squat down into the bottom position, while at the bottom, leaning the knee over the toe for a 30-second hold. Once you complete, you can proceed to make small rotations. This allows the ankle to move optimally in the joint and in the correct position. The second exercise is a weight-bearing lunge with elevated foot in dorsiflexion. This is a good exercise to increase the mobility in the ankle while stretching the calves, hamstring, and hip flexors, glutes, and lower back. Whilst in this position, a pinch in the hip was reported. To try and remedy this before progressing to the goblet squats, we performed a lateral hip pull with band. This movement is good for stretching the glutes as well as the adductor muscles. By moving the leg internally and externally, we improve the hip's ability to rotate effectively in the joint. Alternatively, we could use the goblet squat or any derivatives of the squat to progress the athlete's ability to move optimally. Here we are using the goblet squat. By placing the weight in front of your chest, it helps you learn the proper balance and movement pattern to perform a regular squat. It is useful for building strength, balance, and body awareness by keeping your torso upright and stable while using the legs to perform a proper squat. The second movement is the overhead press. From the side, it is evident that the bar is following a curved path. This is due to a lack of core control, which results in the ribcage flaring and putting stress on the lower back. This can be seen by excessive arching of the back when attempting to press the bar over the head. This is due to a lack of mobility of the spine and shoulder. To create a good posture when pushing the bar above the head, we made use of activation exercises called the resistant band external rotation. Start with your elbows tucked into your sides, with your hands in front holding a resistance band. Retract your shoulder blades and rotate arms outwards whilst keeping your elbows tucked. This exercise targets important shoulder stabilizers and upper back muscles and reinforces good upper body posture. To address lat stiffness, Resistant band lat stretches were used. This helps maintain strength of the shoulder, arm, and upper back. It also improves exercise performance. By bending over at the hip, it focuses on maintaining stability through the core by preventing the arching of the back and promotes flexion in the shoulders necessary for the press. The last intervention, and also an alternative exercise, is the resistant band overhead press. This exercise strengthens the shoulder muscle and increases stability in the body. Pressing the resistant band upward is done with the shoulder or deltoid muscle. In addition, as the band is being pressed, you need to generate tension in your core and glutes, which increases stability through the body. This is a great alternative exercise for barbell and dumbbell presses as it increases the awareness of the body during the movement.